Good afternoon, and thank you for joining us for today's webinar. I'm Ngozi Lawal from the Center for the Study of Social Policy, and I'm delighted to have you join us for this important conversation, building strong local alliances to support your prenatal-to-three agenda, supported by the National Collaborative of Infants and Toddlers, a project of the Pritzker Family Foundation. Today, we're joined by Dr. George Askew and Ms. Krystal Reyes to share strategies to help you build stronger local alliances. In just a moment, we'll begin the webinar, but before we do, there are just a few housekeeping items we'd like to go over before turning it over to our presenters. So first, all of your lines have been muted, but we don't want that to stop you from sharing your questions, thoughts, and reflections. We've only done this just to keep the background noise to a minimum. So at any point during the webinar, we ask that you use the chat box, which is on the bottom right, to submit any of those great questions or thoughts that come to mind as the presentation is taking place. And then we'll be sure to read those questions out at the end so that Dr. Askew and Ms. Reyes can respond. Also, if you use the raise your hand function, which is also found in your control panel, at the end of the presentation, you'll have the ability to talk directly to the presenter. So you can also raise your questions or share your thoughts that way. So that's what we're doing today, and I'll go ahead and turn it over to you, Dr. Askew and Ms. Reyes, to begin.
Thank you, Ngozi, and thank you for inviting us. It's a true pleasure to participate in the webinar today. As you said, I'm Dr. George Askew. I'm the Deputy Chief Administrative Officer for Prince George's County. My portfolio is Health, Human Services, and Education. So what that means is I'm in charge of the health and well-being for the nearly 1 million folks who live in Prince George's County. And within that portfolio is the healthcare system, home visiting, maternal mortality and morbidity, infant mortality, WIC, child welfare, foster care services, and numerous other things as you might expect in a health and human services system. Prior to joining Prince George's County, I was the Deputy Commissioner of Health in New York City, where my portfolio covered the Office of School Health with 1.2 million school-age kids, an early intervention program that served about 35 to 40,000 kids a year, maternal and child health, where we have 120,000 births a year in New York, with home visiting, baby-friendly hospital initiatives. Before going to New York City, I was the Chief Medical Officer in the Administration for Children and Families in Health and Human Services in the Obama administration, after having served as a special advisor for early childhood health and development to the Deputy Assistant Secretary, who was Dr. Joan Lombardi at that time. Lastly, I am a founder of Docs for Tots, an early childhood advocacy organization, and a former 0 to 3 fellowship, 0 to 3 Fellow Leadership Development Institute Fellow. I guess I should say, most importantly, whenever talking about early childhood, is that I am also a Head Start grad, and a very proud Head Start grad. I'm joined today by my superstar colleague, Krystal Reyes, who'll tell you about her background and her tremendous experience in community engagement. Krystal?
Great. Thanks, George, and really appreciate, Ngozi, the invitation to share some of the lessons learned over the years doing community engagement work with families. So I am Krystal Reyes. I'm the Chief Resilience Officer for the City of Tulsa, and I oversee our city's resilience strategy, which is focused on equity with a racial equity lens. And in addition to that, I lead the Mayor's Office of Resilience and Equity, that in addition to the resilience strategy, I oversee our human rights complaints, our small business enterprise program, which supports small businesses with a focus on outreach to minority and women-owned businesses. And we also provide staff support to commissions in the city of Tulsa that provide advice and counsel to the mayor in the areas of Native American affairs, African American affairs, Latino affairs, and the status of women. So we have a lot of inroads with the community here. And prior to my work in Tulsa, which is very recent, I was for the last several years in New York City, and I worked on family and child policy in the mayor's office. I also led a small nonprofit in Hunts Point in the Bronx, providing services and supports from birth all the way through college, working in collaboration with community-based organizations in the schools in that area, as well as I worked with Dr. Askew at the New York City Health Department, engaged a lot in internal practice changes around community engagement and supporting Latino families in infant and toddler well-being and overall support for health. So thanks for having us, and we look forward to kind of sharing the lessons learned over the years of our experience and talking a bit about strategies and how to support families across the spectrum.
Great, thanks, Krystal. We just wanted to run through quickly what we're going to be talking about today. First, we'll be talking about sort of community engagement frameworks and approaches and tools that will help you in your work with engaging around the prenatal-to-three community. A lot of the things that we'll talk about will be applicable across a broad range of community engagement activities, not just prenatal-to-three, but as we go along, we're going to talk specifically during the course of the presentation about special considerations for engaging in this prenatal-to-three space. So I encourage you to be patient if you're wondering, like, well, tell me about prenatal-to-three specifically, where that will definitely appear during the course of the presentation. And then at the end, we hope to have enough time to have a lively discussion around some of the things we mentioned and maybe answer some of your questions that we may not have touched upon during the course of the presentation. So Krystal is going to kick us off with the community engagement frameworks, approaches, and tools piece.
Great. So when we were putting together this talk, we thought it would be great to kind of give a couple sort of overarching frameworks that could help ground the conversation. And so we wanted to share two of them that we think may be helpful in just a starting point to begin to design your community engagement strategy. And so the first one is the community engagement continuum. And this is a continuum that was developed by the NIH in a document called the Principles of Community Engagement. And in my work in New York City, the New York City Health Department really built upon this continuum to develop a Department of Health community engagement framework. So I just wanted to share this for those that may not be aware of it or haven't seen it, but it has been a helpful tool in my experience to help kind of bring forth a couple points around what are the types of community engagement, how to be intentional with the approaches you're taking, whether it's an aspect of your project or a whole program, and how to communicate that with your partners so that there's clarity and accountability on the relationship and the exchanges. So the continuum starts on one end from outreach all the way to shared leadership. And you can see that on the outreach end, it is more of a one-directional relationship. So there's information from, a government agency or a nonprofit going out to community members. A lot of times this is the area, or this is the outreach, or community engagement approach for getting information out so that communities are informed. The next sort of phase or type of community engagement is consult, and this is where I usually give the example, focus groups are a great example of consult. So this is an effort where maybe you are trying to get information from communities, and so you're sort of getting the data from them and using that to inform your process or to inform a decision or inform the design of a project. Involve, collaborate is a bit more bi-directional in communication, and it involves maybe involving community members, helping to design or helping to outline some outcomes. Collaborate is just a little bit more in this space, and actually in the New York City Health Department, our agency had combined those two because they're very similar, but there are some specific strategies that make a project or an initiative more collaborative. And I think communication is one of those key drivers of that. And on the other end is shared leadership. And so this is an approach that really shares power with community members. Not only is it bi-directional, but community members are involved in every step of a project or program or decision from the very beginning. So ideally ideation through evaluation and action. And so that approach is many times more time intensive and takes more planning and resources, but there's definitely some evidence that the outcomes are stronger in terms of shared accountability and more buy-in across communities that you're working with. And so that leads into the second framework that we wanted to share, and that's an approach that's in research, but we really think applies to non-research as well. So it's community-based participatory action research. And this diagram was developed by a colleague at the New York City Health Department, Sophia Polo, and she aptly describes all the phases of a research project, including the action, which is where the action comes in from the PAR. And the takeaway in this framework is that communities are involved in all 10 of those phases. And so I'll just share a definition from a great organization, a great institute. It's actually in New York City that trains on participatory action research, and highly recommend a training like that to ground folks in the approaches and the frameworks and the theory behind this. But the definition that the Public Science Project at the City University of New York uses is that PAR is an approach to research that values the significant knowledge people hold about their own lives and experiences. PAR, or participatory action research, positions those most intimately impacted by research as leaders in shaping research questions, framing interpretations, and designing meaningful research products and actions. And I think, just to reiterate, it talks about research and it was developed in a research framework, but we really think this applies to non-research as well. You can replace that word research with programs, positions those most intimately impacted by programs or services as leaders in shaping those programs and services. And so, just to reiterate, PAR, participatory action research, is community-based, so it works closely and is grounded with community needs, issues, and concerns. It's participatory in that communities are involved in every part of the process, and it's action-oriented. And I think that's super important, that there's a cycle of research, design, action, and then back again. And so it is something that's iterative and also action-oriented to make impacts on communities. So then, now that we've grounded ourselves in those two overarching frameworks, we wanted to just kind of jump into the practical sort of tactics and strategies to begin to engage communities, so you can involve them early on in the process of your project or your program or your service or your advocacy. And so some of the things that we have seen work over our projects and over the years is definitely taking stock of what exists in your own organization, in your own community, whether that's your agency or an existing collaborative or an existing advisory group. Of course, asking colleagues in New York City and at the health department, and of course probably in other agencies, there's probably a database where you could tap into or do a quick search by zip code or by community group. And then, there's just the old-fashioned walking around in a neighborhood, doing some cold calls and scheduling meetings once you do get in touch with someone to begin to build the rapport and the relationship about the project, and as well as attending existing community meetings or events. And then also finding coalitions that exist that may be part of other networks that you could attend and then eventually recruit from. So those are some specific strategies for finding partners and stakeholders to involve in the projects that you're developing. And then I think, George, I'm passing it on to you for some of the conditions for creating meaningful community engagement.
Sure. I want to say that you can't we can't overstate the challenge actually that exists in creating a shared leadership model as well as doing community-based participatory action research, because those are concepts that kind of turn the more traditional way of doing this work on its head. You know, you often enter the room as the person, someone's the leader, the person who brings the dollars to the table, and they try to drive the work. This is particularly hard for folks who for those of you who work in government will understand this, I think, a little bit more, or maybe even foundations, where you may be the one holding the purse strings for the project that's coming to the table, but we're trying to create a situation where everybody's vote is equal, and the decision making is truly a shared thing, and that what you say might not necessarily be the way that the directions that things go, and you have to be willing to let go of that. And that's sometimes hard for, as I said, particularly for government entities, and sometimes for foundations, in my experience. So some of the things that we can do to create conditions for full engagement are, you know, to try to understand and mitigate opportunity costs for community members. You know, what are the things that are going to keep community members from participating that you want to address right up front? And one of the things is to compensate community members or residents for their time and or commitment. One of the challenges that we saw in New York, or one of the things that we saw whenever we do community engagement, is that you often will pay your quote unquote experts. So your university PhD will get you know, a stipend or an engagement fee, but the nonprofit that's running on a shoestring budget of $50,000 a year, that person is just kind of expected to show up at 5 o'clock in the afternoon for a 2-hour meeting to give their opinions and expertise, but we don't pay them for their expertise often. And so we want to make it clear that you really want to pay residents for their time and commitment, and build in things into the budget for like train or taxi or gas costs to get to meetings, often things that we take for granted that truly can be impediments to having community members engaged in your work. You can go as far as to do things like offer childcare or include it in the compensation, to say you're getting extra money because we know you have children that have to, you know, you have to get a child sitter while you're here. So again, you know, try to mitigate those barriers. Assess and address the accessibility issues that impact full participation. What are the things that won't make the meeting accessible? Not just opportunity costs, but what will keep folks from showing up. You know, make sure that you have the right languages available for staff. You want to make sure that they're bilingual or multilingual project staff that can be available. You want to make sure that if you need you know, sign language, you know, that should be made available, and that should be thought of ahead of time. So budgeting for interpretation services is also important, and using plain language. We often don't do this. It's really hard for those of us in one field to talk across other fields. You're really beginning to speak. You know, one of the things that I learned coming out of pediatrics and then doing child advocacy and then doing government, those are 3 different languages. When I was talking to child care people in the military, one of the stories that they gave me was that if you're trying to convince the military to do something, you have to understand that their work is about mission, and anything that interferes with mission is a problem. So, you know, the military gives you all the things you need. And this is exactly what this person said to me. They said, if we'd wanted you to have a family as a military person, we would have issued you one. So what I learned to do when talking to the military is to explain how quality childcare and access to quality childcare contributed to mission, so that, you know, the spouse who was on deployment didn't have to worry about who was caring for their children or the quality of that care, and they could focus on the mission. So, you know, again, learning a different language, that was very important in that piece, and learning plain language, again, to speak without speaking in acronyms, and you know, for me, med speak or pediatrician speak. And if you don't know what those issues are, and what the languages are and what some of the constraints are, survey your participants, understand their schedules, best times to have meetings, what, you know, what's best for you certainly may not work for 30, 40, 50, half of the group. So find that out and be very intentional about it. You want to create a welcoming environment, again, by being very intentional. You can be, these sort of perceptions of power are important. You know, government and educational institutions, foundations can be very intimidating to other folks in the community and to each other. So you want to get beyond that, you know, perceptions of power, so that everyone's on equal standing. One of the things you can do is to transform the meeting space, even like really small ways, like making sure that all the seats are equally spaced and around the room, you know, in sort of in a pleasant atmosphere. Think about place when you're having these meetings. If you're a government entity or a foundation, bringing community members into an intimidating space can, again, blunt the potential ability for folks to feel comfortable, especially in today's environment, where you may be inviting immigrant families and immigrant institutions into your organization, where folks feel intimidated and at risk. And so you have to do all the things you can do to make sure that you mitigate that risk, and so that folks will feel comfortable participating. Provide food, especially if meetings are occurring during meal times. Again, we often have these meetings at, you know, a 4:30 to 6:30 discussion, and then don't serve food. We actually had problems with this when we tried to do this with some of our groups, where we weren't really allowed to use monies that were taxpayer monies to buy food for these meals. So we had to find ways to sort of get around those issues to make it possible. When I look at my food budget here, for instance, I make sure that we don't serve ourselves, that we only serve food to participating members from the community, because these are community dollars, so we should be able to use it. As part of the survey of your members, ask them how they like to communicate outside of meetings, emails, texts, WhatsApp, you know, in person. Again, to make sure that you create a welcoming environment by being very intentional about finding out how people want to hear back from you. Use a consensus decision-making model to address power imbalances. In other words, you know, the typical way folks make decisions is you raise your hands, and if 6 out of 10 say yes, then it's a yes answer, and you're left with 4 people who, you know, didn't really agree to what you're voting on, but it's passing anyway. Whereas consensus decision-making is a more creative and dynamic way of reaching agreement, where, you know, there are no winners or losers, but you get to a consensus where everyone can agree on what they can agree to. In other words, it's not really compromise or giving up anything. It's what is the thing that works best for everyone. And again, in those cases, you don't often get what you're looking for when you walk into a setting, but you get what the group thinks is going to work for everyone overall. And part of doing that is, one of the things that I've learned is, you know, leaving your ego at the door. And that's really hard, because we often enter into these community engagement arenas with our own agendas attached to us, as well as, if you don't get your way, you may feel like you're quote unquote losing. And you really do have to, as I said, unpack that at the door and walk in with an open mind and no ego and no agenda other than what's best for the constituency that you're working for. Again, a tough thing to easier said than done for some folks. And again, you want to finally sort of assess the policies and forms and procedures that could create a risk for some participants. In our community engagement group around sexual and reproductive justice, we had folks who were working very hard for the rights of transgender individuals and other folks in the LGBTQI community. But in order for us to pay them, they had to put their addresses on a form. What we didn't realize, and what we were told later, is that for some of these folks, they're working in a highly controversial area, and by putting their name or address down anywhere, that meant somebody had access to where they lived, and that was dangerous for some of them. And the rules that we had in place were that, well, we can't send checks to a post office box or to another or to a government building. We had to send it to the person's address. Well, again, we had to fix that to mitigate the risk that some folks are feeling that might have kept them from participating. Lastly, on this is, and it goes back to understanding opportunity costs, but also the shared decision-making pieces. You have to be clear right up front what is possible and what's not possible, particularly if you're coming in as the group that's sort of bringing the group together initially. One of the troubles that we ran into, which we didn't realize we were going to run into as a government agency when bringing together a community engagement group, was if the government logo was going to go on whatever was going to be produced, then the government entity actually felt like they had the last say. So even though the folks who were leading the community engagement group came up with a decision, and in this case it was a decision about what would appear as a logo for the breastfeeding rooms that were going throughout the city, the communications department within the health department said, no, we don't like that, we're going to change it to something else, and this is what's going to go out. And in order for it to go, it has to go with the way we think it should look, even though the community said something completely different. Now, if we had addressed that up front and said, well, are we going to be able as a community engagement group to make the final decisions on anything that comes out to the media, and we were told, well, actually it's going to have to go through us first, the process might have been very different, and there might have been fewer hard feelings than we ended up with in that case. Let's see if I can do this. There we go. Now I want to talk about some things that I think are specific considerations for engaging in the prenatal to three space. And these are really based on my own experiences over the years and working in this space. One is, not everyone understands the needs of the prenatal to three community or the prenatal to three space. When I came to, well, even though Neurons to Neighborhoods has been out for years, and the brain science has been known for years about the impact of early brain development, the impact of the environment on early brain development, not everybody knows that. And I think we often in the field take for granted that folks we're talking to do know it. So when I came to Washington 20-some years ago, I came to work at 0 to 3, and my project was on trying to develop language around infant mental health that would resonate with policymakers. And you wanted to get away from the idea that when you talk to a policymaker around infant mental health, that they didn't first see a baby on a psychiatrist's couch, because that's not what infant mental health was about. And so I had to talk to policymakers in a language that resonated with them by talking about social and emotional fitness, and then describe those things that make a child socially and emotionally fit. And I think, and that seemed to resonate better. And you've got to develop messaging that's going to resonate across many sectors. Again, I talked about learning different languages, so learning the language of policy, learning the language of the police, learning the language of the military, the language of news reporters. All of those things are going to be important, and particularly in the prenatal to three space, because it really is a different world. You have to think about the social political culture that you're working in. Because not everybody believes the responsibility for young children lies with anyone else other than the parents that brought them here. So I've been in situations where I've been giving been briefed before giving a presentation in a different state, and the people there said, look, don't talk about childcare during this conversation, or don't talk about government-sponsored childcare, because the folks in this community don't believe in that at all, and they won't listen to anything else you have to say, because they believe that parental responsibility is parental, that childcare responsibility is parental responsibility and not anyone else's. So you need to understand the social political culture that you're working in order to help you define how you're going to enter your community and engage your community well. This is something that we've all seen and heard before. Kids don't vote, and so when you're talking to legislators, you have to be able to move them in a way that gives them a sense of what's in this for me in some respects, because it's not a vote that you're going to get from a child by providing resources and what children need, and often the parents of children, young children, don't vote, because they're often young folks who may not vote as much as older folks. So again, remember, that's one of the challenges and special considerations for working in this space. Inclusion of prenatal is not necessarily universally adopted in the early childhood community. What I've seen is that when you start talking about prenatal care, folks start to ask you, well, aren't you really talking about maternal health? And if you think about maternal health as I do, maternal health is about taking care of women of childbearing age even before they start thinking about having babies. So you're really talking about the complete spectrum of childbearing years through the time, for a kid, they become 3. So again, define what you mean by prenatal and be very clear about it, so that people understand and don't think you're speaking too broadly, or if you're speaking broadly, make sure that that's clear as well. Trying to explain to folks that it's a marathon and not a sprint is a difficult one. Again, this really pertains a lot more to legislators who you're trying to move. They work on very short cycles. They want to see quick return on investment. If I'm putting, when I did advocacy work, a lot of my challenges were particularly when you're doing legislative or policy advocacy, you're saying, well, if you change this policy today, you're going to see kids who are going, for babies, you're going to see more kids graduating high school. Whereas if you had an advocacy, particularly an advocacy organization like the one I ran, but if you had an advocacy organization that said, if you give me $1 today, that child will have a meal tonight, that was the kind of thing that would resonate with folks. But a lot of the things that we are talking about with prenatal-to-3 is really sort of the marathon, like making these investments today are not necessarily going to give you that quick return tomorrow or even the next day, but maybe years down the line, and recognize that you have to be able to present that argument in a way that's going to resonate with folks and that they'll support. And even though we're all kid folks, and generally the folks that love kids are thought to be very selfless, and we can be surprisingly siloed and very territorial. I think part of that is driven by the fact that so little is invested in kids, such that people see the pie as being small to begin with, their portion of that pie being small, and it's a zero-sum game, so that if a piece of that pie gets bigger for someone else, someone's piece of pie has to necessarily get smaller. And that's where we have to sort of try to expand the pie, make it so that we'll feel less territorial, less siloed, and be willing to work together. And again, getting back to that, leaving your personal agenda and your personal ego at the door will certainly help that. Krystal, I think I'll turn it back to you.
So And then going back to once you're in sort of the project or the program or the advocacy effort, factoring in a feedback loop for you on how it's going and assessing things from an equity lens. So for example, asking questions like who is missing, or who, I've been asking the question, okay, naming who was involved with creating this effort. One tool that we found is a sort of a set of questions around how communities were engaged in a research project. And I think it applies to non-research as well. And it's something that I think can be used, but also something that can be created around looking at your guiding principles for your project and then assessing with community partners, have we adhered to those principles and what could we be doing better and what should we keep doing? And so checking it individually with community members and referring even back to the community engagement continuum. For example, if we said we were trying to do something in the shared leadership space, have we co-created every aspect of that project? Just asking those questions is very simple, but also can be very powerful. And then naming where there are some gaps. I think that's also important, that because for the external people or the receivers of a project or a service, or say an advocacy, or you're just informing, it's important for them to know as well who was involved in the process and also who's not, what communities weren't addressed or weren't included. Not to say it was a failing, but just to name it so that everyone is aware and it's transparent where the input was in this project and where there could be improvements going forward. Just going back to the community engagement and developing meaningful partnerships is an iterative process. And then we just wanted to recap a very high level sort of steps, recognizing that there's a lot of guidance and a lot of materials and information out there. And so what we're hoping to do here today is just sort of culling that for everyone and sharing some of our personal experience. So one of the things that we just thought we'd do is just do a quick recap of process and steps. So meeting with community partners to help you plan, being clear about commitments needed and the deliverables needed from all the partners, including community members, and being intentional, using some of those strategies we outlined to create meaningful engagement. And then focus on engaging more stakeholders as the project continues. So sometimes, and I've experienced this, where over time your group gets smaller and smaller as you're going forward. But if you can think about ways to include more people, more stakeholders, or more voices as the project continues, that can only help with buy-in and awareness and understanding. And then, of course, as we just mentioned, assessing your approach periodically and getting feedback from partners in a meaningful way, in a systemic way. So let me just, I think that was it. We wanted to land there and I guess open it up for questions.
Well, and since we have one more minute, I just wanted to mention something that I think I'd be reticent to not mention, and that is one of the things that we should be intentional about in bringing together communities and in the communities at your work are biases that are existent in the community or that might be existent in the group. That includes race and racism and other biases that really ought to be part of the lens. Particularly in the communities that we work in and in the country that we live in right now, and to be very intentional and upfront about where that could interfere with the work that we're trying to get done.
Thank you, Dr. Askew, and thank you, Ms. Reyes, for your presentation. We are going to open it up now and see what questions the participants have. So we'll just give it a minute so that folks can type questions in or type in their reflections, and then we'll read those out.
I see one question that I can read, Ngozi. So it says, great slide mentioning surprisingly siloed and territorial. Can you give some advice or suggestions on how to go from a spaghetti approach to a systems approach? For example, agreement to coordinate and collaborate on a variety of home visiting strategies. How do you build a community approach versus a siloed, funded, individual spaghetti approach?
Well, it's interesting that you should mention home visiting as a as an example. We one of the things that we were working on in New York was building a coordinated intake and referral system for New York, similar to what they've done in other places. I think New Jersey, Baltimore. One of the first things we did was get everybody into the room. And sort of make sure we had all the players in the room, or at least as many as possible, and make them part of the planning committee. And one of the things is trying to assure people, and as part of the work, assuring them that they weren't going to lose, again, their piece of the pie, so to speak, and coming up with a system that would allow folks to continue to survive and thrive as a business while also greatly impacting the sort of the need of the community and allowing us to expand, but also being very intentional with saying, here's what we think are the important pieces that go into a home visiting program, evidence-based programs that have proven outcomes, but also allowing for room for other sort of promising practices to be part of that, or special populations that may not be actually evidence-based, but maybe, but this group of folks aren't going to get covered by any of the other organizations because nobody else is going to be in this community. But again, trying to make sure folks had their piece. And my experience with this grew out of my first work on the federal side when the new home visiting monies became available, was really watching. And this is probably, I feel quite comfortable in saying this, when watching the folks sitting around the table, when we were trying to decide, well, how are we going to distribute the monies that are available for home visiting throughout the country, and what programs will cities be able, will states be able to tap into, which ones will be part of that list of programs you can use. There were some really interesting battles where folks really weren't about leaving their egos and agendas at the door, but really, in some respects, I understood. If you think your program is the best program to serve the needs of our country's children, then you push that forward. But at some point, you have to, again, think about the broader good, and and I think folks found that hard to do. I think we finally got to that point, but it took a while, and it actually helped me when I tried to do the same thing in New York to know what people were going to be thinking coming into the room. It's a challenge, that aspect of it, and it's got to be you have to be very thoughtful and intentional about it, and know it, and be thinking about it coming into the room. I hope that's helpful.
Hi, this is Erin again. So while you were talking, I was thinking about some of the work that we here actually at CSSP have been doing with our parent leader network and parent engagement. And in some of our materials, we talk about prioritizing resources for parent and community engagement. So is there like a line item in your budget that says we're putting money aside to pay people when they help us do our work? Was that something that you experienced when you were in New York, and was there any opposition to doing things like that, and how would you respond to it?
There was, I would say, opposition to it, and it came on the administrative side, where the rules that were created, the rules were not created with community engagement and shared leadership in mind. So it was a matter of bringing bringing the folks who were in administration, who handled the purse strings, into the room to talk with the folks in the community engagement group so that they could actually hear the stories and understand what the issues were. And then surprisingly, you can find answers when you're able to talk to people directly and say, all we're trying to, for instance, this issue of, all I'm saying is I can't put my address down because it's going to be dangerous for me. Can you just change? Can you change the rule? And then when the administrative folks understand that, it's like, oh, okay, that will just take a slight rule change, and we can make that change. When it came to food, there just had to be a clearer explanation of why this was needed. It was after hours. It had to be limited. And I think when all was said and done, you can find ways, even around rules that were made before this concept of shared leadership came into play.
Okay, great, thank you.
So we've got a question that reads, a lot of what you both talked about today has to do with building trust. How do you build trust in situations where there has been mistrust?
Sure, I can jump in. This is, this is a question that grappled with in my time in New York, and also even here in Tulsa, where there, and it depends. Sometimes there's data on this, and sometimes it's just, awareness and being part of the community around lack of trust in government, particularly. And so one project that we were involved in, the way that we mitigated or addressed that was to actually talk about concerns and sort of apprehensions that community members had at the very first meeting in the first half hour. And then that may sound a little out of the ordinary, but we structured it in a way to name that exact issue, that we want to do this project in a transparent way. We want to do this project that has positive impact on community members. What are things that you are, as a community member, as a partner, as a person, that community member that we're engaging in, what are your concerns? And even talking about ways that trust has been broken in the past and why that is part of the narrative for them now. And I think just naming that early on in an engagement process, I think, is really key. And that can be hard for especially those in government to hold space for that. But it's also part of what George said, is sort of not about sort of our own ego in that, and it's not personal. That takes a while to really internalize. And even just as a new leader in government here in Tulsa, building trust begins with building those relationships and showing up to places and being in spaces where community members are, and seeing their organizations, their events, and participating and really seeking to understand what they're trying to accomplish, what their experience is, and being in spaces. So those are two strategies that I have implemented and done, and have seen work to mitigate those issues around trust.
Thank you, Krystal. So we have a follow-up question. Sorry, George, did you want to chime in before we get to the next question?
I would just reiterate what Krystal said particularly around transparency, and that's one of the most difficult things. Again, particularly in government, is to folks want to know what's going on behind the screen, right? Because there often seems to be a lot that's going on behind the screen. There really isn't. But letting folks know right from the start, here's what's possible, here's what's not possible, here's what we can tell you, here's what we can't tell you. You can't be part of the interview process for the folks who are getting RFPs because of your connections. This is my job as a government person, and this is what I have to hold close. But here are all the things you can know and should know. I think if folks are feeling you're being genuine with your transparency and being as transparent as you possibly can, that's very helpful.
Great. Thank you. So we have a follow-up question to one of your responses. So the question is, can you speak more to anyone who you think does the coordination piece really well? You mentioned New York City, New Jersey, and Baltimore. Can you say more regarding how they coordinate on home visiting?
Wow. How can I say more about how they? Well, my first thought is that you should certainly reach out to them to have them sort of explain more, because I feel like I might not do justice to their programs. But what seems to work is that the things that I was talking about, where folks didn't feel like they were losing their share, their quote unquote share of the pie, that there was an intake that was sort of transparent and by the accounts of all fair, so that if a family is coming in and they have specific needs, there was a criteria that would select a family to go to, nurse family partnership, or to healthy families, or to maybe a homegrown home visiting program based on the needs of the family. So having an intake and decision framework that everyone could agree on, that everyone can agree and say, yeah, if a family comes in with those needs, they really ought to go to this program because that program suits their needs better. One of the things that we were challenged with in New York is we offered home visits to every child born in shelter or who moved into shelter up to 2 months of age. We were challenged by the city to add a component program that would address abuse and neglect, and they asked us to go with a home visiting program that didn't address those issues, although it was a home visiting program. And we said, well, that program doesn't really address that issue. We really ought to go with this other program. And it took some finagling to get folks to understand that it's not a one size fits all. But also it gets to the point of, if you have the criteria, or you have a flow that says, here are the needs, here's the program that meets those needs, here's a program that meets a different set of needs, here's a program that meets this set of needs, and everybody who was at the table making that flow chart come together, agreed upon it when you left the room, or at least you came to a consensus agreement. That, I think, is what these programs were able to do successfully.
Thank you. We have a comment, and I'll read it. This is from Bob Frawley in New York, and Bob says, please make sure that George and Krystal know that New York misses them, especially after listening to their presentations. You can never have enough strong leaders.
Oh, that's very nice.
Thank you so much.
I'll have to say, I do miss New York.
Indeed, I do.
So we don't see any more questions in the queue. We just want to, seeing we have just a few minutes left, just give folks one last opportunity to raise their hand or type in a question. Okay, well, I don't see anything new in the queue, so we can go ahead and close. We just want to thank you both for sharing your wealth of knowledge and just all of the great stories of how you've worked in the different facets of your career. It's so helpful to hear about how building local alliances, especially from the prenatal-to-three perspective, can help the participants on the phone think about how to advance their work. So I think what we'd like to do as a next step is after this webinar, you will get a survey, and so we ask you to complete it so that we can always improve these. And then 2 days, so on Friday, 2 days from now, the audio of this webinar will be sent to you as well as the actual slides. And of course, if you have any questions, you know how to get in touch with us. So thank you for joining today's webinar. And we just want to put in a plug for our final webinar of the summer series that'll take place on next Thursday, August 29th, that has to do with leveraging your local and state chambers of commerce to support prenatal-to-three. So thank you again and have a great afternoon.
Cheers, everyone.
Thanks.